Every day we come in here because we actually get to make a difference.
We're standing on the shoulders of giants.
You're coming in and talking to somebody who cares about you and wants to know what's going on with you.
I felt like I could affect change, not just good for HIV positive patients, but great.
It's a family.
When I come to work every day, I feel like I'm making a difference in our community, and that's important to me.
And when people are complimenting us about the work we do, sometimes it gets me a little emotional.
APO is a one-stop shop for HIV and AIDS services in Southwest Missouri. We're the only specific AIDS service organization in our region. We are now also opening up to primary care for the entire community regardless of HIV status. My name is Lynn Meyercord. I'm the Executive Director of AIDS Project of the Ozarks, also known as APO. My job is to keep our doors open, and my job is also to make sure that our clients and the community are receiving the best possible services they can, which means keeping our staff happy with their work environment and trying to make this job one they want to come to every day. If the staff aren't happy, our clients aren't going to be happy. We provide HIV/AIDS services to 29 counties in Southwest Missouri with a focus on underserved populations. We offer HIV testing, also testing for chlamydia, gonorrhea, syphilis, and hepatitis C, which is a huge issue in our region. Last year, APO served right around 760 folks with HIV. We tested right around 1,600 folks, and we did outreach to probably over 15,000 people. We've come an incredibly long way from 1985 when a group of concerned folks started our agency because people were coming home to die and there were no resources here. Then gradually as the epidemic spread, we had our own community members who were infected and were dying of AIDS. So that's how we got started. Very small building downtown in the Landmark building. We provided minimal prevention services and we tried to provide emotional support services. It was all volunteer-based, with the exception of a part-time executive director and a very part-time support services person. Greene County and the state came up with just a small amount of money to help keep doors open, where we could take phone calls, we could tell people what doctors to go to, we could, give them what information we knew of and what resources we knew of. But it was a very difficult time. In '91, the federal government started the Ryan White AIDS program and provided grants for medical care, for case management, so people could have support services, because many folks, they would find out they had HIV or AIDS, they were already sick. If their job found out, especially in our area, they could be fired, they could be evicted, they lost everything. And now we are here on Glenstone with 49 staff members. We've got staff members in West Plains, in Waynesville, in Joplin.
I'm Sandra Terrell. I'm the Chief Financial Officer. At AIDS Project, I oversee their budgeting process. Also work with the 340B program. It sounds like a really exciting thing. It's lots of numbers and spreadsheets, so right up my alley. Our 340B program actually provides a lot of additional funding so that we can support our clients and keep our community healthier. We have found that the more funding we are able to get from our community, the higher our viral load suppression is amongst our clients. And what that means is if your viral loads are suppressed, then you're not going to transmit the virus onto another person. And so therefore, our community is healthier.
We've got a good viral load suppression rate, but we're seeing new people coming in. My name is Paula Howell, and I'm the office manager. I oversee building operations, process of submitting grants, invoices every month, and that keeps us receiving our money in a timely fashion. Even though I'm in the back office, I still get to communicate with clients a little bit. I help cover the front desk.
APO, this is Marcia. How may I help you?
Marcia gets breaks and lunch, and we all rotate, and I've always felt it fair that I rotate along with the rest of the staff. A lot of people don't realize that AIDS is still an issue. They think that that was something back in the 80s and that there's not a problem anymore. There's still a problem, and there probably always will be, and that needs to be addressed.
I grew up in the 80s, and so part of my youth was shaped by the HIV epidemic. It affected people I knew, and at the age of 20, I decided I wanted to work at APO. My name is Cecilia Havens, Project and Compliance Director, And that's pretty important as we grow, to make sure that we are compliant with federal regulations and to make sure that our entire agency is behaving in a legal and ethical way as we move forward and grow. If you are receiving federal funds like Medicare, Medicaid, which we are, you are required to have a compliance program. Those of us that didn't work the front lines still have the honor and the privilege to work with the people that were on the front lines in the 80s and the 90s. Those are my heroes, and I get to work with them, and I get to know them, and I get to love them on a personal level, and I can't think of anybody else I'd like to be surrounded by.
My brother was diagnosed with AIDS in the late 80s, early 90s, and after he died, I made a commitment to HIV and AIDS. I'm Lori Massey. I am the Director of Quality Management and the Regional Case Management Supervisor. We want to be able to provide really good care to our clients. And the way to provide really good care is to make sure we have information that shows that to us. My role is to create data that I can take back to the community, the APO staff, back to our consumers, and help them understand where we are with viral load suppression. I will also work closely with the providers to look at individuals that have yet to become suppressed, and we can sit down together and figure out some trends. In comparison to statewide data, we are at equal to or above viral load suppression rates. It's something we should be really proud of.
I'm Becky Herron, Director of Case Management. We make sure that people are eligible and certified to access the Ryan White funds, which pay for people's medication, medical care, housing, transportation, access to food pantries. One of the unique things that APO offers is our hygiene pantry. We stock it strictly by donations. Anything from shampoo, toothbrushes, toothpastes, to laundry soap. And that's a service that's not offered in the community, so it's really used and needed by our clients. You know, when you go to the doctor, you get your care, and then you're done. Period, and you leave. Like here, we're right here, the case management team is right here with the doctor. So we know what your doctor has said, like, hey, this is what you need to do, or this is what you can do. And then so we're there to kind of help the client follow up with that. So the fact that all of that happens in one building is, I think, a big advantage that we have and what makes us so successful. In mental health, like if we have a client having a crisis, we walk over to Julie and say, hey, can you meet with the client for a bit?
Like you're coming in and talking to somebody who cares about you.
I'm Julie Mackey. I'm the Behavioral Health Coordinator. I do mental health services here at APO, and I also refer people out for a variety of mental health services. Mental health on site. Bert brings his baby for support. Generally, when people come in and get tested, I get an opportunity to meet with them. And a lot of times it really shifts both their view of themselves and their worldview. So helping them kind of navigate through that shift and go through the emotional part of dealing with the diagnosis is really a big part of what we all do at APO. And I think that that's huge in helping them navigate and accept the diagnosis and create a sense of themselves that they didn't even know might have existed before the diagnosis. I have access to the doctors, to the case managers, to prevention. There's this whole agency that works holistically on their health.
Hey, good to meet you. Come on in.
You get your case management here, you get your medical care here, you'll get tested here. So we take you from the very beginning point of when someone is diagnosed through their entire medical care piece.
I'm Bob Holtkamp, and I'm the Director of Prevention for APO. Yeah. Our main goal is to reduce the impact of HIV, hepatitis C, and STDs on the individual, and thereby improving the overall health of the community that we live in. We do outreach education to a variety of groups, whether it be teen groups, drug treatment centers, schools of nursing, colleges, any group that we can get together and provide information to on an educational forum. We also do outreach in communities for testing We also have a testing program, an active testing program here at the office and at APO downtown on Friday and Saturday nights from 5:30 to 10:30. I do go out into the community and do educational programs. Traditionally, prevention has worked with providing testing, access to testing, and also access and distribution of condoms. But with the U equals U, undetectable equals untransmittable, we want people to know they're living with HIV. Not only do they can come in and get appropriate medical care for the health of themselves, but it also reduces the risk of transmitting it to the partner. Pre-exposure prophylaxis is called PrEP. And what that is, if you're at higher risk of acquiring HIV because of activities and frequency of partners, or if you're living with someone with HIV, you can take a pill daily that will protect you by reducing the risk of acquiring HIV by over 98%.
I have watched clients go from hopeless to hopeful, and from having no life at all to having very full lives and working due to medications and great medical care. I'm Melissa Tiffany, I'm the clinic director. If somebody comes to APO for HIV services, we assess where they are in the disease process, and then the provider creates a treatment plan with the patient, and they coordinate that care together. And then the care team takes over, and they're going to be assisted in every aspect of their treatment journey. We have served HIV positive patients since 1991, and we will continue to do that for as long as we are here. But we also have primary care services for patients, and we serve those living with hepatitis C, transgender patients. We have a PrEP clinic, so we serve a wide variety of patients. We are in network for both Cox and Mercy insurance plans. I had originally lived in San Francisco and saw how the disease had ravaged the community there. When I moved back to the Midwest, I just decided that I needed to get involved. I wanted care to be great. I wanted services to be great. I wanted to see people grow and be healthy and excel.
We do a lot of preventive care for patients that happens to be different for folks who happen to be LGBT than it is for the general population. And having that specialized knowledge and skills makes us a better fit for this community. I'm Dr. Stephen Adams. I started on the board of directors. As medical director, I've worked here 1 or 2 days a week through October of 2017 when I became full-time as the physician working at APO caring for our clients. One of our newest goals is to start people who are newly diagnosed with HIV on medicines the same day that they're diagnosed. So a patient will come in, get their HIV diagnosis, spend some time with a case manager, spend some time with one of my nursing staff, and then spend some time with me, and at the end of the day they walk out with their prescription. So our medicines are easy to take. They're incredibly powerful, well tolerated, and provide folks an opportunity to live an absolutely normal life. We've had a significant increase in the life expectancy of folks who are diagnosed with HIV, and today a diagnosis of HIV will not shorten your lifespan as long as we can get you on meds before your CD4 count is below 350.
We don't have the traditional medical model that a lot of clinics have. For them it works, and it's with good reason. We want to be a little more flexible here. People have a lot of obstacles in their lives, a lot of challenges in their lives, and we don't want medical care and getting access to medical care to be one of those challenges.